Well, hello and welcome to everyone around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Welcome to all of you tuning in today. I'm very excited. We're talking about our Gold Learning Day, which is coming up in the new year. You need to head over to the website right now, goldlearning.com. It'll be a kickoff event of the year, and I'm so excited. It'll be a great day of learning as we have Dr. Joanna Strybosch, who is with us here today. Welcome, Joe. It's so good to have you here today. Joe and I've had a chance to sit down already and talk a little bit about what's coming up. We're so excited about the topic that, of course, you're going to be speaking to: supporting babies with birth injury, optimizing positioning, and latch. It seems like this is going to be a big topic, Joe. How excited are you to sort of get into it with people? Because this is a topic that can really be challenging to work with. You've got families that are dealing with injury, sort of watching their infant with an injury. And then maybe you've got some complexities that a practitioner hasn't seen before.
Thanks, Fiona. Yeah, I'm super excited to be here and talking with you all here at Gold. This is a passionate topic for me. It's something that's really driven my practice for a very long time in many ways. I've worked as an osteopath for, closer to 30 years now, and particularly in the paediatric space. But layering that more recently with becoming a lactation consultant and IBCLC has just really elevated my practice to another level, because I'm able to combine my skills as a manual practitioner along with lactation advice. But if I reflect right back to when I first began as an osteopath and I was interested in breastfeeding and working with babies who were having difficulty feeding, this is before I did my training and before I knew much about breastfeeding myself. But it was really, I was always concerned for mothers that I would see, parents that I would see that had been unable to breastfeed, and just the sense of failure and sadness around that. And what I was observing many years ago was that there was often a sense that it was them as a parent that had done something wrong, or they weren't able to breastfeed, or there was just this sense of failure, which made me feel really, really sad for a lot of parents, because oftentimes there's actually something going on for the baby that actually could be improved. And what I was seeing in my practice was that often mums had been unaware of that. And so they were learning about that, years down the track. And there was a real sense of regret and loss around the breastfeeding journey. So that really sort of was a bit of a fire in my belly to understand more about the interplay between pediatric conditions and breastfeeding. And so that's really what I'm going to be talking about in some ways.
Yeah, absolutely. I love that you're an osteopath, and it's, you've been in this practice for a very long time. I think you just mentioned 30 years. And we were talking off camera because I was saying that, osteopathy has, of course, been around forever, but it hasn't always been well utilized, I feel, in the field of medicine. Sometimes it's still hard to find an osteopath. But where are you located, Joe? Maybe you should tell folks, kind of what does practice look like for where you are in the world?
So I'm in Melbourne, Australia. Here in Victoria, the state that I'm working in, there are a lot of registered osteopaths nowadays. Although back when I was graduating, it was a lot less known. It has spread broadly across our country, but particularly in the eastern states. I understand it's less common or less known of in some parts of the world. But it really is a fantastic way to approach body work for infants and parents too, I might say.
Right. Yeah.
So it's just a really it's a manual practice. It's a hands-on type of therapy. And so we're looking at coming along and supporting function of that infant, joints, muscles, ligaments, tendons, and just making sure that everything is moving optimally, because one of the tenets of osteopathy is that structure governs function. And so if those structures are altered in some way, be it very small, it does alter the overall function of the body. Yeah, so that's what we're looking at from a very biomechanical point of view, understanding how all of the parts of the body combine to create overall function and try and optimize that. And so in the topic of birth injury, of course, you can appreciate how relevant that is.
Yeah.
And we're also, I'm going to be talking a little bit more about just getting creative and finding ways of supporting babies who can't move as normally as possible, who might have pain or restriction or what have you, and how that just with sensitivity, we can usually always find a way to support parents to feed their babies.
Absolutely love that. And as you're describing it, and I, of course, know a little bit about it, it just reminds me of how closely it really is aligned with, lactation, looking at the bigger picture, the whole picture, but those biomechanics, those subtleties, that can really make or break. And like you said, it can be one of those things that folks don't find out about until later on. And I love the way that you sort of incorporated that into sort of sharing, there people don't know, and then they find it out later, come back, and there is regret there. So, it is exciting to know that you can do this, that this is becoming something that's more common and folks are seeing it around the world. So I'm truly excited, of course, that you're going to be sharing on it. Can you tell me a little bit let's talk a little bit about birth injury, because I feel like, this can be quite devastating to an entire family. It could actually incorporate both the parent and the infant. In some respects, there could be injury to both parties. But I know predominantly you're going to be sharing, of course, about feeding and such. But tell me what it looks like when you go into a family and, I sense that sadness in my heart, that they are dealing with something. This is not what they planned, Joe. And now you are sitting with them. What is it that you start to, sort of immerse into that conversation with them? How do you begin?
Well, yeah, it is often a difficult and sensitive space to work in with families. When a baby has been injured during the birth process, invariably mum has also experienced a traumatic delivery.
Yeah.
And so there's a lot going on. She's physically recovering. She might be still having difficulty even to sit, to walk, to carry her baby. And, there is a degree of psychological trauma involved with that too. And then so to learn on top of that their baby has some sort of an injury, can be a really fraught time for a family. And certainly if I'm the one who is informing them of what's going on for the first time, then, yes, there are tears often. And, I have to really hold the space for that family. But it's also, I find it a real privileged space to work in because, I care very deeply for the families that I work in, and I'm a real optimist when it comes to their breastfeeding journey, and I really love to be that person that can come alongside them and give them hope and a belief that they can achieve a feeding success, whatever that might look like. And so yeah, it is a beautiful space for me personally to work in. I work in private practice, not in a hospital setting. So I'm seeing families after they've been discharged home. So it might be a couple of days after the birth. It might be a few weeks. Occasionally it's even a few months after. And sometimes families turn up with a knowledge of what's going on. And sometimes, less so. And so it can be quite a shock when they're in a consult with me and discover the extent of what's going on. But it also gives such clarity and understanding to perhaps some of the challenges, the unsettled behaviour they might have been seeing, the difficulty positioning that they might have been experiencing. So to be able to come alongside and just give them some advice and tips on all of that is a really wonderful space to be working in for me, and I believe very hope-inspiring for the families.
Yeah, I love that too. I can hear kind of that flow of, where things just seem like they've gone from bad to worse in some respects, and then having the ability to sit with you and find out that there is in fact ways to support them and ways to move forward. With your clients, and when they come to you, do they come to you as a lactation consultant and then you bring in the osteopath? Like, how does it work for you? How do you blend the two together?
Yeah, it's, well, I suppose what I do is fairly unique. There are a few of us around, osteopaths who are also IBCLCs, but not many. So yeah, look, honestly, it can be either or. I certainly, through my website and so forth, people generally know that I do both, but not always. So sometimes I have referrals to me for babies who need osteopathic treatment, and then I'm having that conversation and saying, oh, and I'm a lactation consultant as well, and so sometimes there's like, oh no, I didn't. Oh, that's fantastic. I've already seen another lactation consultant. Oh, this is very handy, or whatever.
Yeah,
so that's great. But very often people do choose to come to see me because they do appreciate having both skill sets there, and it really does work hand in glove. I'm very grateful for the training that I've received in my career. I find that the two skill sets go so beautifully together, and it's just really elevated my practice to another level, and it's made me even more passionate about the work that I do. And honestly, all these years later, I feel more excited about my work than I ever used to. And so it's just getting better and better as, I suppose with experience, brings a lot of expertise to the work. And so I just feel very grateful to be able to give back to families what I have learned. And yeah.
That's absolutely fantastic. In your presentation, can you give me a couple of things you're going to be sharing on? And really, I'm always intrigued too when you put a presentation together. I know from your experience and my experience, often things start to develop. Are there some things that you loved putting into this presentation? I know you're going to be speaking live with us, but I know that you've worked very hard to bring all these elements together. Give me a couple of snippets of what we're going to be learning.
Yeah, so I particularly would like to focus on the condition of torticollis because it's something that I see a lot in clinical practice, and it is one of those conditions that if his treatment is commenced early and the right advice is received early, then babies go on and make great progress and have really good success. But if left unchecked, it can progress and develop into downstream a condition, and the breastfeeding journey can really get off on a tangent. And so torticollis is one that I'm really going to speak to. I also talk about brachial plexus palsies, such as Erb's palsy, and also clavicular fracture as well, because these three conditions are some of the most common birth injuries that at least I see in my clinical practice.
Yeah. Well, I'm very excited, Jo, honestly, to have you on board, and I can't wait for everyone to come and listen. You'll be actually doing this live in the new year, so that's going to be exciting. But of course, if folks can't make it there on the day, they'll be able to come in and listen to the recording, which is also just wonderful as well. Thank you so much for being with me here today. It's been wonderful chatting with you.
Welcome. Thank you, Fiona.
And to everybody listening in, don't forget you can head over to the Gold Learning website right now. It's pretty easy, goldlearning.com, and check out all the details of this upcoming event, Gold Winter Gold Learning Day. And we're so excited to be looking forward to having Jo there. Thank you so much for joining me here today, and have a wonderful rest of your day. Bye-bye for now, everyone.